This is a 27 or 28-year-old young man who presents with 20 tics: eye blinking, eye rolling, head jerks, shoulder shrugs, facial grimaces, mouth opening, throat clearing, grunting, yelling, and screaming, barking, coughing, squeaking, pitch or volume changes in his voice, echo phenomena, which means he repeats what other people say, arm extending, touching objects, finger smelling, jumping or skipping, thrusting of groin or torso. The clinical information we received on him was that he was diagnosed with Tourette's syndrome at 9 years of age. He was put on multiple medications. He has blurred vision. He states, "I feel like I am going to pass out." This is a feeling which is with him constantly. He has subjective hearing loss, bilateral finger numbness, and his TMJ MRI was negative. TMJ information is that he had bilateral clicking upon protrusion of the jaw. He had no clicking upon opening the jaw. He had right frontal, temporal, and occipital headaches, increasing in severity. He has left retroorbital pain, right ear pain, or right otalgia, bilateral tinnitus, bilateral face pain, bilateral preauricular pain, and bilateral lower jaw pain. He has difficulty chewing food, a constant sore throat, feeling of a foreign object in his throat, bilateral suboccipital pain, bilateral neck and pain, bilateral stiff necks, cervical crepitus upon movement of the head, and right shoulder pain. This is this patient's cephalometric x-ray, and it is an example of a patient who does not have a very good airway. Look how narrow this is. Look how overgrown or enlarged is his soft palate that blocks this airway almost completely. This is this patient's frontal head x-ray. Even though C1 and C2 seem to be centered and aligned in the midline of the patient's head, notice that C1, which is this whole bone here, is rotated because this is the spinous process of C1, this pointed structure, and is supposed to be aligned with the odontoid process of C2. The midline of the teeth, the odontoid process, and the spinous process should all be in the same line in the midline of the patient's head. This is a young 28-year-old man that presents with Tourette's syndrome. We have given him the tongue blades to find out at what height, what vertical dimension his symptoms decrease. And in the last 2 days or so, he has determined that 8 tongue blades are what stops everything. So put those in. Here he is with 8 tongue blades in, and this is what gives him total relief. In measuring, come in on this, 8 tongue blades equals 15 millimeters, inner incisal opening. Okay, this will be our starting point. Okay. We have just increased the height of his appliance about 1 millimeter, 1.5 millimeters on both the left and the right sides. And he states that his urges have decreased from 50% to 70 to 80% less than they usually are. We'll dismiss him for the night with this degree of treatment and reevaluate him tomorrow morning in about 17 or 18 hours before he leaves home for Kentucky. What's it done for your urges?
Well, the urge is still there, but it's, not like it was.
How much less? Like 50%, 80%?
Oh, probably 50%.
Okay.
I didn't know if it was not yet high enough or what.
Well, usually I make it higher tomorrow, but
yeah.
I might do it right now, in fact. Okay, spread your teeth here. Okay, zoom in on that. Okay, let me get a ruler and okay, you can see this appliance results in a 8 to 9 millimeter interincisal opening, and which he says his urges to tick are about 50% gone. So we're going to increase it a little bit more today, see if we can get a better decrease in his urges to tickle.
It's made a big difference, and appreciate Dr. Stack and what he's done. It's a change in a life.
Yeah. This gentleman returns after 17 or 18 hours of wearing his appliance. It was delivered yesterday afternoon. He says his ticks and his urges are down approximately 75%, and that wasn't good enough for us, so we increased the vertical of it approximately 1.5 millimeters on each side, and we have rebalanced it, and you can see the difference it's made. Now, say something to the viewing audience.
It's like I said, had it in, and the ticks have went from 75% probably to 90% now, and no urge so far to do anything. It's a lot more comfortable than I thought it would be. It's not very invasive, but takes some getting used to. But it's definitely an improvement.
Okay. That's a 90% reduction in his Tourette's ticks in 17 hours. No one else is capable of doing that. How many years have you been trying to get treated?
Since I was about 8 years old. I'm 28 now, so 20 years.
20 years of treatment. This gentleman has had his lower appliance exactly 1 month. Tell him what you've been experiencing in the 1 month you've been wearing it.
Just getting used to it. Wore it down pretty good, but even at its worst, the ticks have been 50% better, 60% better than what they were before I ever had it done. But it's not a problem to eat with it anymore, not a problem to talk with it. It's like I say, at its worst, still an improvement, 50%, 60% improvement.
Your family members and friends and acquaintances, what's their impression been?
They're just speechless. They can't believe it. It's just anybody that knows me knows that it's changed completely. Like I say, when I got back and it was built up right, nobody could just hardly believe it because it all just disappeared.
Okay. Today we have resurfaced his appliance and built it back up. The amount that he ground it down plus a little more, and we're going to fit it to him right now. I tightened it up for you too, huh? Right. Okay. Jump. Okay. Does one side feel higher than the other?
Yeah.
Which one?
Side,
Okay.
right here.
Okay, take it out.
I can feel it more on my front teeth there than.
Gotcha. Okay. Wait. How's that feel now?
That's better.
Better? Okay. Does it decrease your urges?
Yes.
Yeah, okay. Okay, I'm going to give you a little more room for your tongue here. And